Good afternoon. I'm Mark Ramey, Chairman of the Marion County Board of Supervisors, here with Kim Dorn, Director of Marion County Public Health, again to give you an update on COVID-19 and things that are going on in Marion County related to this continuing crisis. Kim, we've got some updated numbers for folks as we've reported on the last several weeks. So what are our new case numbers?
Okay, right now we have 110 active cases. 395 are recovered, and unfortunately we've had 2 deaths.
Had 2 deaths. So what can we tell the public about the 2 fatalities related to COVID-19?
That they were both over 80 years old and they both had pre-existing conditions.
Okay. Well, our hearts certainly go out to the families who have endured this tragedy in their lives as a result of COVID-19. We don't want to hear about any deaths in Marion County. We wanted to keep that number at 0, so it saddens all of us that this has occurred. As we think about moving forward, again, we're still dealing with some of the fallout of some of the large events that occurred in Marion County, but are we seeing improvement?
We are seeing improvement. It was very common for over the last couple of weeks for us to have 20 and 30 new cases a day, and today was about 10 last time I looked. Yesterday I think we had 6 that come into my inbox, and then things get sorted after that. But I'm seeing improvement. There's and I think that overall things are starting to slow down a little bit, but we really need people to stay home when they're sick, or when or even if they are tested positive and they're feeling good. That's when it's really hard for them to stay home. It seems.
That's a great point. So when we think about all the behaviors that we've been talking about, I've been reading a lot of articles over the last 3 or 4 days, especially in the states like Iowa that have had an increase in cases. People are getting fatigued. They're getting tired of all whether it's mask mandates, whether it's stay at home, wash it. People are just getting fatigued about all of this. But we still need to do certain things to keep these case counts down. And one of those is if you're positive, feel good,
you still need to stay home. And if you are a direct contact of a positive, you still need to stay home. I understand that you're feeling good and you want to go to work and you want to go do your thing, but we really have to do the isolation and quarantine. That's what's going to get us to the other side of this.
Okay, good. It's a good reminder for all of us. Long-term care and assisted living. We've had some cases in these facilities. What's going on right now with our progress in those facilities? We haven't had an outbreak yet.
No, we have not had an outbreak, so we've not met the threshold of what the state would call it an outbreak. So it's still 0 on the state website.
Okay.
But the facilities are working hard they're doing some testing. Folks generally know that there was a positive in a facility. And we did a lot of testing there. The staff at the facilities that are affected have been fantastic to work with, and they've been very responsible and very concerned.
Okay.
So they're doing the right things.
That's great. That's great. Positivity rates. This is another topic that we discussed last time. The schools use this number on whether to meet, along with absenteeism, kind of the 2 metrics the schools are using. So, without getting into a whole bunch of detail on this, how are we doing there, especially as it pertains to schools?
Well, it's decreased.
Okay.
It was 17 this morning. It was 17.2, I think it was yesterday, and today, this afternoon, it's 16.6. So it's eking its way down.
Okay. But the criteria for getting a test remains, especially for Marion County Public Health. We're really trying to get people that are showing symptoms to come in and take those tests. So those numbers are going to stay higher as long as we have COVID within the population.
Right, and as long as, we are, for a while, we were just testing Anybody who felt like they needed to have a test, whether they had symptoms or not. So we've tightened that criteria, so I'm not going to be surprised if that number goes up.
Okay,
Because we're doing a tighter screen on the front side,
mhm,
and so there are people that we actually do the test for are more likely to be sick.
right. And we want, those are the people we want to find out.
That's right,
For, not just so we have a number, but for their sakes as well.
absolutely.
So that we can go on with contact tracing and those next steps, right?
Right, so I can use an example. I had somebody call me this morning who, they were a close contact, about a week ago of
Mhm.
somebody. And she said, I just kind of have the sniffles and I don't feel sick, but I'm a little bit afraid to go back to work on my day 14
Mhm.
after my quarantine, because what if I actually have it? And I said, that's a really good question, so you should come in and get tested so that we can confirm that it is it or isn't it, because even the slightest symptom with COVID can be COVID.
Right, right,
And you could be completely asymptomatic, you could just have a sniffle.
right.
And so in order for that person to go back into their workplace and feel like they're not going to accidentally expose other people.
Mhm.
So it was a good,
That's
it was
great.
a good discussion,
Yeah.
and it's a good example of why we want to test people who are seeing symptoms.
Okay, good, no, great comments. Well, again, the behaviors that we want to reiterate again, and I know people are probably, this is where the fatigue comes in.
Yeah.
But
People are
these
tired.
are, this is all we have right now until we get a vaccine.
Mhm.
You will hear there's differing opinions from the federal government on when we will have that. Some are saying sooner, some are saying later. But before that happens, we have to socially distance,
Right,
wash your hands,
Mhm.
stay at home when you are sick, wear a mask when you're not comfortable or you can't socially distance.
right.
And you've got highlighted in my notes, stay at home when you are sick. So is there a reason why you've highlighted that?
There is.
Okay.
Because people are tired of being told to stay home, and again, if they aren't really sick, I mean, some of the people who are really sick with COVID, there's no problem getting them to stay
Yeah.
home. They can't get out of bed.
Right.
And so we're very happy when they recover and that, but even those folks, we need to cut them a little slack, because they still are, experiencing dizziness and things like that, even after their 10 days. So if you know somebody that's been positive and really gotten a good case of it, they're gonna take a while to get up and around again.
Okay.
So we need to be patient with those folks and cut them some slack.
Yeah.
But then the others who are feeling good and it's just a sniffle, I'm sorry, but we really need you to stay home until 10 days after the test or 10 days after your symptoms have started.
Okay, good. Well, again, Kim, thanks for the update. We sure appreciate, again, everything that you are doing and public health is doing. Again, we have 110 active cases. We've had our first 2 recorded deaths in Marion County.
Right.
Again, our condolences go out to those families. And we hope we don't see any more
Right.
deaths within Marion County. Again, 110 active cases, population of 34,000. We're doing, again, pretty well considering the spike in cases that we've had.
Right.
So, thank you for your time. We'll be back with an update next week. Have a great afternoon.